Suicide. More than 700,000 people die due to suicide every year. Suicide is the fourth leading cause of death among 15 to 29 years old. 77% of global suicides occur in low and middle income countries. Ingestion of pesticides, hanging, and firearms are among the most common methods of suicide globally. My name is Varun. I represent Medicus, an e-health platform available in India, United States, and Caribbean, offering online doctor consultations and lab tests to customers, as well as telemedicine and second opinion cancer care services to businesses in India, United States, and Caribbean countries. The topic we want to discuss today is suicide, which is a very important subject that everyone should be aware of, not just for themselves, but also to provide the extended support for the people around us. To discuss this topic today, we have Dr. Sumanth TP. He has got more than 18 years of experience as a psychiatry practicing in Vijayanagar, Bangalore, India. He is also a professor of psychiatry in Rajarajeshwari Medical College, and he's got wide experience in acceptance and commitment therapy, anger management, applied behavioral therapy, cognitive behavioral therapy, dialectical behavioral therapy, emotion focused couples therapy, hypnotherapy, interpersonal psychotherapy, etc. Dr. Sumanth TP is available on medicasapp.com. We have a website, and you can also download Medicas on your Android phones as well as your Apple phones by going to the respective stores. So let's welcome Dr. Sumanth TP and let's delve into this topic and see what we can uncover for today. Dr.
Okay.
Sumanth, welcome to today's session. How are you doing today?
Good morning, Varun. Thank you for this wonderful opportunity. Yeah, of course, Varun gave me a wonderful bio. So, yeah, I'm basically very briefly, if I have to tell what Varun just said, I am a psychiatrist, a consultant psychiatrist based in Bangalore. I work as a professor of psychiatry in the Department of Psychiatry at Rajarajeshwari Medical College, Bangalore. And also, I'm a consultant psychiatrist at various hospitals in and around Vijayanagar, Bangalore. Yeah, this is very brief about me. Yeah.
Thank you, sir.
That,
Thank you so much.
yeah.
Sir,
Okay.
so I believe you're well aware of our topic of discussion today, Sumant sir.
Mhm,
It's suicide, right? The
mhm.
word is scary, definitely scary, but it depends again from person to person how they perceive suicide. So we have a series of questions. What is suicide? What are the types of suicide? Are suicide rates actually increasing? Can suicide patients donate organs? What suicide does to a family, the impact what a suicide can actually have on a family, how suicides can be prevented, what are the differences between suicide and homicide. So these are different types of discussions that we want to have with you, Sumant sir, but probably you can enlighten us by giving us an understanding of what is suicide. Please go ahead, sir.
Yeah. See, understanding suicide itself is a very complex and, of course, a sensitive subject. The reason being that uh, suicide defines a phenomenon or a behavior that goes exactly opposite to your survival instinct. There are very few examples seen in some animal kingdom, which is mainly unique to man. Because why would somebody want to take their life? Because which goes against our survival instinct. And understanding that and preventing that is a very major concern. And as you say today, almost in many age groups, youths, middle age, even in old age, the suicidal behavior is being increasing, and that's something we need to tackle. Of course, the world is also trying, and we have to do our bit. Uh,
Sorry, I was on mute. Okay, so I was about to ask you. I believe suicide goes way beyond in ages, and people actually commit suicide for various reasons. And I believe experts like you would have categorized them into a certain categories. So, what are the types of suicides, sir? Can you, probably throw some light on that?
okay. Yeah, the suicide actually can be categorized many ways. And firstly, I would say about talk about suicide types of suicides, or like the commonest way we categorize is whether it's impulsive or non-impulsive or premeditated. Impulsive is in the moment's notice stuck, you just attempt suicide. Something bothers you, somebody says something to you, or in the fit of the moment, it's a matter of minutes to maybe an hour. Suddenly, you just feel like doing it, you do it. But then again, there is something called planned. You wait your time. You have been feeling suicidal for a particularly long time. You plan yourself, the method, how you want to go. Maybe you do all the take care of all your needs, family needs, and then you go, say goodbye, and then you go. So uh, they have a slightly different way of handling, because we can't anticipate impulsive suicide, but we can definitely to some extent anticipate premeditated suicide. And suicide, when we talk about suicide, it need not be just suicide. Is what it means is the death has already occurred. So basically what we are targeting is suicidal behavior. So either it could be suicidal thoughts, we call it suicidal ideations, or it could be suicidal planning. You are already started planning, or you have attempted and but survived. Because and ultimately, people who are successful in attempt are called suicide patients. Okay, so we have to target all of them. So help them. So
Exactly,
even
sir.
yeah,
Exactly, sir. Sorry to interrupt you. So, I think that's where I have a small doubt that has occurred to my mind. So, you have spoken about impulsive and non-impulsive suicide, wherein
mhm,
a person at the nick of the moment may probably have not planned about it, but due to that intense heated moment, that person would be doing something which he must probably not would have not thought about what would be the after effects of it, and that would have happened. We derive that as a suicide. And the second one is about he has been planning for it for a while. Now, probably if you can actually help us understand the ways we can prevent suicide, what are the different methods that either we or a person who is thinking about preventing suicide, that would actually help our audience a lot, sir. Can you please help us understand?
yeah. See, firstly, as you just said, impulsive suicide attempts, especially with no back history or past history of suicidal behavior, is very difficult. So it's very difficult. Premeditated suicide attempts, yeah, to some extent there'll be a lot of signs. Maybe people have failed to recognize. So firstly, you have to recognize signs like maybe they're acting suicidal. Signs can be like some depressive symptoms, anxiety, or psychotic symptoms, in the sense signs of any psychiatric illness or mental health issues. So somebody is feeling low, somebody is crying all the time, expressing hopelessness, excessive guilt, feeling, oh, nothing is going to get better. I'm always the future will always be bleak, and they're very pessimistic. That is one of the sign of low. Then maybe there are people who talk about, romanticize about suicide, say, oh, how it will be to die, how it will be to get rid of all the pain and everything. And they talk to friends and colleagues, or maybe people are trying to say goodbyes to your loved ones, and saying, okay, I think this is the last time I'm seeing you. These are ways, some of the hints you give. So basically, it's always, whenever we see upset, it's always better to talk to people. So, and mind you, most suicidal patients don't come to a psychiatrist first. Usually, they come to
Oh,
some other doctors. So
right.
it's your general practitioners. They do seek help, most of them, but we unfortunately fail to recognize that.
Okay.
Because when they come, we think we treat their physical illness. We don't ask, okay, buddy, how are you doing? How is life? How is family? Any stress? So when we ask that, maybe they are actually ready to spill out beans many times, but we are so concerned about, we, and I say general practitioners or family members, we don't look into that. We sometimes have this myth, if we talk about suicide, perhaps he will start committing suicide. That's not definitely, it's a myth. Person who wants to commit suicide will commit either way. So it's
Oh,
always better to open up and talk to them. So yeah, so these are some of the signs. There are many signs, I think, that having any psychiatric issues, romanticizing about suicide, talking about it, or saying your goodbyes. These are some of the things we need to look out for, or trying to be lonely, or avoidant of others. All these things we need to be careful about.
absolutely, sir. You actually made a point, and I can actually relate it to our real life scenarios as well. You talk about suicide to a person whom you may feel that he's low. That person may commit suicide. That's a general tendency, I believe, in any family, sir. So, so let's say if we feel, I mean, it's obviously because of a lot of negativity we have around us, and of course, it depends upon each individual as to how they perceive things and situations around them. There will be a lot of cases and scenarios in our day-to-day life that we will feel low. Now, what should a loved one, what should an individual or a family member should do to extend their help? You know, even before they take that particular patient or the particular person who is suffering with that low morale, to ensure that they sustain the situation without having to get it aggravated before they even take it to a psychiatrist, sir.
See, basically, family, your friends are your first point of contact. So I, as a psychiatrist, can't be there 24 bar 7 to my patient.
Exactly, sir.
And I can, while I will provide support, but it is always the family we need to prioritize, your loved ones, your friends, or your colleagues. So it's always best to get help where you want, and because that is the support structure we build, help for the support system for the patient. So the thing is, yeah, loved ones, especially if they have not had any past suicidal behaviors or looked low, it is always better to talk to them. And sometimes when we talk, we just talk, we don't listen, and we need to actively listen. We need to listen what is happening. And moment they talk about suicide or suicidality, we should not just shut them up and say, hey, don't think about this. We need to listen. People would not just jump to suicidal conclusion. So we need to ask them why they're feeling, what's making them, how. And some of the times, the best way we can offer support is ask them how they need support, because
Right.
let's not pretend we know everything about them.
Right.
They are the people who knows, and they want support, they want in a particular way. And we can try the best we can give this, whatever support we can give. Yeah.
Sure, sir. Sure, absolutely. So, what kind of support functions are available in our day-to-day life if we want to seek help? Of course, now that we know that a psychiatrist is an ideal person who will handle the suicidal kind of scenarios or tendencies and all. Other than a psychiatrist, because see, there is a social stigma. Going to a psychiatrist means that that person is mentally ill. That's what usually every person thinks. But do you think are there any other support functions that are available in public where a person can privately can go to along with talking to a psychiatrist? Or any other support functions are available?
Definitely, there are many systems available. As I told, the first and the primary resource is the family. And today you have a lot of crisis helplines, hotlines, suicide hotlines. The moment you put the word suicide, Google will show you a number for which you can contact for a suicide helpline. So in India, there are suicide helpline like Sahai and everything, and maybe abroad in each country there are different helplines. So of course they are the first line; they will always help you, and there's always your local psychiatrist professionals. Professionals cannot just include psychiatrists; they could be psychologists, psychiatric social workers, counselors. See, sometimes while being very professional will be needed, but even any help for that matter is always beneficial. Of course, if you feel you're not able to connect with this person, there are always other people. If not one psychiatrist, maybe there are other psychiatrists. So we need to stop thinking the just because you talk with one person and you feel that not that connected, that's not the end of the line. So understanding that there's always help, there are different people who can help you, and there are support groups for if you are depressed, if you are suicidal. You talk to all these people. Okay. So, and for the matter, this Medicas app itself, you're feeling suicidal, you call up patients, and you can connect with the doctor. And
Absolutely.
yeah.
Absolutely. I mean, that's one of the very reasons why we want to discuss about this topic, because it's always important to give away back to the society. Anyone who feels low in their morale, or they are discouraging, or they feel helpless, definitely we are there for you. Please call us. We will help you connect with the experts like Dr. Sumanth. So they'll guide you personally, because suicide is not a general topic. Suicide is more of a personal issue. Correct me if I'm wrong, Dr. Sumanth. So every counseling will happen to you on a private basis, and every counseling is going to happen with you on a personalized basis as well. So Dr. Sumanth is available on Medica's app, and we will try our level best to ensure that we bring you out of that mental state of committing suicides, and obviously how to take perceive things in a positive manner. See, I understand, Sachira, when it comes to committing suicides, especially I'm talking about a very general scenarios, like a student unable to get marks, and he's afraid that his parents may not like him not getting marks, is one scenario. The second scenario, which is a very common scenario I'm talking about, is financial instability, or they're wrecked financially. The third most common scenario, which I think most of you guys can relate to, is love failure. Now, these three scenarios that I'm talking about are more personal, of course, when we have to deal about it. If any person feels very low, helpless, what is the first thing they should do, sir? And what are the steps that you recommend them to take, so that they will feel better about it? Of course, when you get what you need, you will obviously come out of that situation. For an example, you get first rank, obviously you're happy, you will not even get back. You get your loved one, your this problem is solved. But in a scenario where the damage is done, you're helpless, what should I do to come over that suicidal tendency?
Yeah. See, of course, you did mention some of the very common uh, uh,
Scenario.
scenarios where we
Yes.
find suicidal behavior. People are suicidal. Yeah, I think it all starts again with listening, identifying and listening, and being proactive. So, and we do, even if the patient doesn't leave alone patient having active suicidal thoughts, even if any patient or a client doesn't look suicidal, we will always make it a point. Like when you come to a doctor, they always check your BP and pulse and everything, no matter
Right.
what condition. So, as a psychiatrist, and I think as any general practitioner should ask this, that of late, do you feel bed low, or do you feel depressed? Do you feel suicidal? Because the patients, people are waiting. Many times, people are waiting to do it, or and sometimes really suicidal people might not want to tell it, but when you talk to them, maybe they might have a last moment change of mind and they will open up. So it's always important to ask them
Right.
directly, not bothered about the myths that, oh, if I talk about suicide, you'll get some ideas and everything. Definitely no. So talk to them, and more you talk to them, more you'll start getting to understand the problems from the patient's or the client's point of view. What are his troubles? See, of course, we might not be able to solve everything, but we can work with the patients in a small graded fashion, step by step, how we can implement problem solving. So firstly, look in for what are the support structure he has, who are the people he can rely on, and maybe help with that. And if there is a issue, how best you can tackle. And more than anything, see, issues, problems will always be there in us humans. So what we need to learn to do is we need to see uh, how best we can help them handle these issues. Okay.
Right, sir.
So making them understand that life is much more important than these issues. So failure doesn't mean it's the end of the line. So supporting them morally, emotionally, and creating a support a system, and in case there are any crisis, making sure there's a way they can handle the crisis, where they can reach out for support immediately. So creating this kind of environment, yeah. And of
Exactly,
course,
sir.
if there are any psychiatric issues, underlying psychiatric issues, addressing them as well.
Absolutely. Sir, I think probably I want to actually say something here. Maybe you can correct me if I'm wrong. See, with this nuclear world, the families are no more joint.
Mhm.
Even, when we have these nuclear families, everyone nowadays have their own world, which is nothing but their smartphones.
Mhm.
The tendency of people, I actually observed it. When you go to any park, when you go to any, public places, back then, when there was very less availability of mobile phones, people used to chit chat, they used to smile, they used to laugh, they used to play around, they used to share some emotions and everything else. Now it's surprising, even when you go to a hotel for a family dinner, the four members of their family will have four phones in their hands, and they're just waiting for the food to be served. They'll eat and they're going away. So, do you think people should connect more with people than the phones in order for them to understand what is the other person's feeling? Because, as you rightly said, active listening and talking to the people, here in the first scenario, we are talking about a student failing. So, if the parents interact with that student on a regular basis, do you think so we can eliminate most of the suicidal cases, sir?
Definitely, in the coming to the student case, what's important is definitely you need to be interacting with your son, understand what he's going through, and many times it's the parental pressure itself. So the pressure to succeed, pressure not to fail. So that's a more important, especially with this particular scenario. The what we don't understand, the lesson we're forgetting is failure is not a bad thing. So
Right.
my favorite saying is learn to fail or fail to learn. Okay. See, as you said, if you get a pass marks or a distinction, you clear your exam, become the topper, anybody can face it. What is the big deal in that? But is it there in you to fail and still come out and still perform, still try, and not care about failures? So today the society needs to learn to fail. I'm not asking you should deliberately fail, but when failure comes, we need to learn to handle. We need to develop resilience. So that is very important. So the problem is, it's a very competitive word. Everybody wants to succeed,
Exactly.
and we want to succeed every time also.
Exactly,
So
sir.
that's not a ideal scenario. We need to understand there will be ups and downs. We need to take the ups as they come, and we need to take the downs as they come, and so we need to take them both, and that's what will build a strong character. Okay, it will make us resilient to these things. Okay,
Exactly, sir. Exactly, sir.
so
Thank
parents should understand that failure is not a crime. You fail an exam, you are not committing some crime. Yeah, it just happened. There is nothing like a fail. We need to understand there's nothing like a failure. There's only feedback. Okay, so we need
Exactly.
to take it as a feedback. Okay, I failed this exam. So what is the feedback of this? So where did I not perform? Maybe this I should have done. That I should have done. I should have done differently this way. Maybe I should have written this way or read this kind of books or studied this many hours. So we need to take failure should not be taken as you are totally failed. It should be taken as a feedback to improve. Okay.
Exactly.
So
Exactly.
any person worth his salt in this world has had his share of failures, and only after learning from there he has come and been whatever great person he has been. So this is what I
Absolutely.
would want to say. Yeah.
Absolutely, sir. Failures are definitely a stepping stones for success. I believe we know a lot of people like Albert Einstein. We spoke about Thomas Alva Edison. They did not succeed in their first attempt. So all of you,
Exactly.
failure. They failed a lot of times. There are rhymes that we teach our kids. Web a spider trying to crawl up the ladder or the tube. It rains, it falls down, and it reattempts again to climb up. So there are a lot of rhymes that we teach our kids how to react to a situation to ensure that you succeed again. But failure are definitely not failures; they are the stepping stones for success.
Yeah.
So, can you educate our public? as to what does a suicide do to a family. Let's say an important person of a family commits a suicide. Of course, every person in the family is very important. I'm not saying that there are only few people who are important. What does it do to a family if a person in the family commits a suicide? With your experience, sir.
Yeah, see, we have done various studies and everything about family history of suicide, what happens to family and everything. So we need to understand that, uh, see, whatever we do in our life is a learned behavior. We are just imitating how we eat, how we face our troubles, how we face bad situations. We all learn. And suppose a father or a mother or a child, anybody does, the rest of the family is heartbroken. And in a way, you're opening door for suicidal behavior in other people's as well. Okay, because if you have a family history of suicide, the chances of you committing suicide increases, goes up. Likewise, if you have a past history of suicidal attempt, again the chances of you committing suicide goes up drastically compared to general public. Okay,
Okay.
so these are two things we need to keep in mind. See, what is happening is, let's say the father commits suicide. What is the lesson or a role model is he being to the other people in the family? So you have problem, suicide is the option. uh, Instead of that, you have problem, you try to deal with it, you try to face it courageously, you seek help. So if you do that instead of committing suicide, the family members also learn this. Okay, they also learn, yes, there are other options which I can exercise. So definitely it will traumatize. So we have seen many times one suicide leading to other suicides in the family because they get into depression and people become guilt. So what happens if somebody, let's say a child commits, in the first case the child committed suicide, what do you think is going to happen to the parents? They are going to be guilty, they'll blame themselves. Even if they are actually not the reason, also they will blame themselves. It can be vice versa as well. If the parents commit suicide, the child may blame itself. Oh, maybe something was wrong in me, that's why they committed. And that guilt will lead, maybe make them depressed, and maybe also end up in suicide. So definitely, suicide, while it might affect a person, it also affects a family. Okay, it
Absolutely.
leaves them in tatters. Yeah.
Thank you, sir. Thank you for enlightening us. There is one, important question I want to ask because, as you rightly said, seeking help when you have a tendency of committing suicide or even going near to that place. So, and there is a lot of social stigma, as I was talking about, when it comes to seeking help from a psychiatrist, from a professional psychiatrist who will, bring you down from that, kind of a tendency. Do you think online platforms like Medicus, can you explain the process, sir? Because I believe you can privately sit in your room with your phone, one on one with the doctor, take counseling sessions, and come out of that situation. Do you think that is possible? Do you think people who are feeling low, either when they did not do well in the exams, failed in their love matters, financial crisis, log on to Medicus, connect with you, privately sit in their home and conduct these counseling sessions and come out of that situation? Do you think it is possible, sir? Can you please explain the process?
Definitely, definitely. See, because while I would definitely say that the situation about mental illness and its stigma is a lot better than what it used to be earlier, but there is still a very long way to go. That is, people still feel stigmatized walking to a psychiatrist or a mental health worker seeking help. It is seen as a sign of weakness, sign of no strong will or anything like that. So many times that itself becomes a barrier for seeking help. And definitely online platforms like Suicide Helpline or these kind of platform like our Medicus app definitely address a key deficiency in this, where you can seek a lot of help directly sitting in your home. You're feeling suicidal, all you have to do is download the app and connect with a doctor who is available there. So there is immediate help. Sometimes there will be certain situation we don't want to talk with our family or friends, maybe we're very embarrassed about it. And because we as psychiatric professionals, we maintain confidentiality, so you can definitely talk to us. There is nothing, there is no downside to it. Okay. And definitely, of course, I will also put the thing is, online platform will never be a replacement for going and seeking help. uh, I would always advise you to go and seek help. But then again, if you are still in the two minds, so don't waste time. Reach out to us in whatever way you can, and we'll definitely help you. So whatever you say will be confidential. We will try our best, and we have been doing that. So I can say many patients have been helped, many people suicide. Sometimes it is just that moment. See, even the suicidal impulses comes in waves many times. So when there is a sudden urge, just talking about it to somebody, telling your pain itself, you don't have to give any medications, you don't have to do anything extra, or you don't have to do any complex therapies. Just listening to somebody, being supportive of them goes a long way in preventing suicidal behavior. So in that way, medicals have online platforms. This is a very great. This would be. This will definitely help us. Okay.
Absolutely, sir. Thank you so much. So, for all those who feel low when it comes to their morale or when it comes to their ability to do things, or any other behavioral issues, any counselings that you need, any psychotherapies that you need, any kind of behavioral therapies or anger management, especially Dr. Sumanth is excellent when it comes to anger management skills. So he counsels those people who wants to maintain their anger levels intact as well. So feel free to connect with him on medicasapp.com website, or you can download our app on Google Play Store as well as our App Store and connect with him. Take personalized, confidential sessions with him, and I'm pretty sure that he'll bring you all out of the situation based on how you follow his guidance. And yes, thank you so much, Suman sir. It has been a wonderful discussion today. This is an important topic that we wanted to get enlightened from experienced professors like you. Please go ahead and conclude this topic for today, Suman sir. And this has been a great opportunity for us to learn from you, sir.
Thank you very much, Varun, for this wonderful opportunity to address this very important issue. The pleasure was always mine. Yeah.
Thanks, everyone.
Thank you very
We
much.
will connect again with another topic. Until next time, have a good day. Bye bye for now.